I have two interesting studies to share with you this month that are both from the April JAAD, and they both have to do with acne. So the first one is a study that came out of Brigham and Women's in Boston, and it looked at a couple of different groups of people. People without acne, people with acne who were not starting on any oral medicines, people with acne who were starting on oral antibiotics, and people with acne who were starting on oral isotretinoin. And basically what they found was that there is a small link between having acne itself and having inflammatory bowel disease, but there was no link between taking isotretinoin or taking oral antibiotics and having inflammatory bowel disease. So I think, this is interesting. The absolute risk was still very low, so it's not something that we have to start screening every patient with acne for. But what we can take away from this is that the use of isotretinoin and oral antibiotics, specifically tetracyclines, does not increase your risk of inflammatory bowel disease. We've had other studies come out in the past that have also shown this, but we continue to accumulate more data showing that these medications are safe. The other study is similar. This study came out of Germany, and it basically looked at two groups of patients who were either starting isotretinoin or starting oral antibiotics, and basically looked at their risk of inflammatory bowel disease. The bottom line for this study was that there's no difference in the lifetime risk of inflammatory bowel disease between the two groups. So whether you were starting antibiotics or isotretinoin, your risk was the same, and it was basically very, very, very low. And there were some nuances here. So the first 6 months of being on isotretinoin, there was a really small, slightly increased risk of ulcerative colitis only. And after 6 months, that increased risk went away. The absolute risk was, again, very small, so not a significant number of patients in any way. Again, I think these two studies together tell us that we can safely treat acne with isotretinoin or with oral antibiotics if that's appropriate, and not have to worry too much about bringing on a new onset case of inflammatory bowel disease. So more data to add to our arsenal about the safety of these medicines, and I think that this is great news. Let us know if you have any questions, and certainly acne is one of our specialties here at Clara. Come on in and see us if you need help treating yours.